I'm here with epidemiologist Bonny Specker from South Dakota State University, who today is going to talk to us a little bit about running averages and also what's going on over the last week locally, regionally, in the state, nationally, and in the world with COVID-19. So Bonny, what do you have for us today? What has happened over the last week and what do you have?
Thanks, Chelsea. Well, what I'd like to do is talk about running averages. And I thought this would be a good opportunity to sort of provide a mini lesson each week on things that we do in epidemiology and maybe explain some of the slides that are posted on your website each day. This slide's actually from yesterday. It is a slide of the number of confirmed cases of COVID by day. And each of these blue bars tells you how many cases there were. So on this day, back say about June 14th, there were 8 cases reported in Brookings. You can see it's bouncing pretty much all over. We have a lot of days where there might be 1, a couple days where there's higher numbers. And it's hard to get a feel for what's happening with that data. And this yellow line is what we call a 7-day running average. And I'd like to explain why we use running averages. The running average sort of smooths out those short-term fluctuations, the ups and downs that you see in the data. And it's good for giving you a better idea of long-term trends. If we didn't have that 7-day running average, the data would look like this. And it would be hard to actually visualize what's going on over time. I mean, you see these ups and downs, but you know what's actually going on. Now, the reason we have a lot of fluctuations is that there are fewer cases reported on the weekends. They're Sunday and Monday almost consistently, both not just for Brookings, but the state of South Dakota and the country and the world. There are a lot fewer cases on Sunday and Monday. And that's not because people aren't getting sick on Sunday and Monday. It's because the positive tests have to be reported and then they have to be entered onto a database. So people tend not to get tested, or that maybe they're tested, but the results aren't getting reported on a Sunday because a lot of people aren't working, say in the clinics, and some of the health clinics might be closed. So we have these fluctuations. We also have small numbers. So the intent of this 7-day running average is to give more of a view of what's going on and to look at those trends over time. And this slide just shows some different lengths of time. So, and the running averages. Here is a 3-day running average, and you can see it's picking up a lot of that up and down. It hasn't really smoothed out the data very well. The 7-day running average, this middle graph, is what we report, and it's actually what most departments of health report. The CDC reports the COVID data in 7-day running averages. And you can see that it's smoothed out a little bit. It's not as variable as this 3-day average. Now, a 14-day running average is even smoother. The problem with that is we might not be able to pick up when an outbreak is starting because it's so far out, but it really does smooth out that variation. COVID is a very infectious disease and it can change really rapidly. So you don't want that running average to be over too long of a period. 3-day running average, that is being used on a worldwide basis. That's the only place I've seen where they've actually reported 3-day running averages of COVID. The 7-day running average, as I mentioned, is the most common. It's what the CDC uses. A lot of state departments of health use it. The city of Chicago uses it. 14-day running average, really too much time is elapsing before you can get a feel for what's going on in a change in trend. And you really need to be able to pick up that change in trend on a much shorter time span than 14 days. So that's our mini lesson In our Epi 101, we're going to get everyone learning epidemiology and understanding this. As far as this week, there have been some milestones. Not such very good ones. Worldwide, the new cases per day have increased from 255,000 to 269. There are now over 20 million cases worldwide. The deaths per day this past week have been fairly constant at 5,800, with 750,000 deaths worldwide. So we're inching up to that 1 million mark. Nationally, the new cases per day are fairly constant and with about 55,000 per day. And we've had close to 5.5 million cases nationally. The number of deaths per day has been fairly constant at about 1,100, with over 170,000 American deaths. As far as South Dakota, today we went over 10,000 cases. That's kind of one of the milestones I was mentioning. There were 653 new cases this past week. The number of new cases over the last week increased from an average of 87 to 93 cases per day. And actually, I think it was earlier this week, South Dakota was added to New York's quarantine list. So anyone from South Dakota going to New York will have to quarantine for 2 weeks before they're out in the public. There have been 150 deaths, which is greater than the median annual number of deaths from influenza, which is 32. So we're about 5 times the number of flu deaths that are typically seen. There has been a decrease in the average number of deaths per day, with 6 new COVID deaths posted in the past week. In terms of Brookings, we've had 17 new cases and 1 new hospitalization this past week. So we have a total of 145 cases, 5 hospitalizations, and 1 death. So Chelsea, some of the people have asked me about Sturgis and whether we've seen anything increase. I just want people to know that if you're from out of state and you go to Sturgis and you come down with COVID while you're in South Dakota, it will not be counted as a South Dakota case. It will actually be counted for the state where the person resides. So we don't really expect a big increase. I think people in Meade County may be at risk, and I'm watching that, and I don't really see anything yet. They have had a couple cases, but not a large increase. So we haven't seen it yet. That's all.
Well, thank you, Bonnie. I appreciate so much you presenting this every week, and thank you for the updates.
You're welcome. And if people want a certain topic covered in the mini lesson, let Chelsea know and I'll be happy to do something.
The email will be included in the link of this video. Thank you, guys. Talk to you next time.
Thanks, Chelsea. Have a good weekend.
Bye.